Nitroglycerin ointment is a topical medication used to prevent angina pectoris. It is a nitrovasodilator commonly known as organic nitrate. It is used as prophylactic to prevent angina attacks. It can reduce intolerance developed during exercise. This ointment is also available for treating anal fissures. However, it is different from the ointment used for angina. They different strengths and are therefore not equivalent. Ointment intended for angina contains nitroglycerin at 2%. On the other hand, ointment used for intra-anal purpose contains nitroglycerin at a low strength of 0.4%. How to apply this nitroglycerin ointment for preventing angina? Is there any measurement required? Yes. Nitroglycerin ointment should be applied carefully to the skin by measuring the proper dose. It is supplied with a paper marked with length in inches. It should be used as per the recommended dose by measuring on this paper. So in this video, let's cover such points as how to measure, how to apply it. We also focus on how it works, what the effect of other medication is, and common side effects. How to use this ointment? This ointment should be used to prevent angina pectoris, but it is not used for acute treatment. Since it takes some time to produce vasodilatory actions, it is not suitable for immediate action. Therefore, nitroglycerin ointment is used to prevent chest pain, so it is used as prophylactic. The dose of nitroglycerin depends on the patient's conditions and the strength of the ointment you are using. Typically, half an inch of 2% ointment contains 7.5 milligrams of nitroglycerin. Normal dose is 2 daily half-inch doses containing around 7.5 milligrams applied in the morning and 6 hours later. This ointment is supplied with a thin paper applicator. It is impermeable and marked with a ruler for proper dosing. You can put the paper applicator on a flat surface with printed side down. Squeeze the ointment from the tube on the applicator up to the mark of length suggested. Normally, half inch of ointment is applied 2 times a day. However, the dose may be variable based on the patient's conditions. Place the applicator on the skin and allow to spread gently. Don't rub or apply pressure. Cover the paper applicator with a transparent cover and secure with tape. This applicator allows ointment to be absorbed through a much smaller area of the skin. Don't apply to the skin area that is cut or open. It should not be applied to the skin with hair. For the treatment of angina pectoris, the normal dose ranges from 0.5 to 2 inches. Apply the first dose in the morning after waking up and the second dose 6 hours later. It is better to maintain a 12-hour gap overnight to reduce the development of tolerance. How it works? Nitroglycerin causes dilation of blood vessels. It can affect the both veins as well as arteries. Dilation of veins can reduce the venous blood pressure, thereby reducing preload. Nitroglycerin can also reduce the arterial vascular resistance. Thereby it can reduce afterload. It also reduces myocardial oxygen demand. It improves coronary collateral circulation, which increases blood supply to the cardiac muscle. It can also reduce the systolic blood pressure. In the body, nitroglycerin is converted into nitric oxide within the vascular smooth muscle. This results in the activation of cyclic GMP. This cyclic GMP can bring relaxation by inactivating myosin light chain kinases, commonly known as MLCK. MLCK is activated by raised levels of calcium in the vascular smooth muscle. It is required for phosphorylation of myosin light chains and their interaction with actin filaments that prompts contraction of vascular smooth muscle. Nitroglycerin increases cyclic GMP levels, which results in inactivation of MLCK. This prevents contractions, leading to vasodilation. Use with PD5 inhibitors. Phosphodiesterase type 5 inhibitors are the medications used to treat erectile dysfunction and pulmonary hypertension. Drugs like sildenafil, vardenafil, and tadalafil belong to this category. These medications cause relaxation of smooth muscle, including vascular smooth muscle. They increase intracellular cyclic GMP levels, leading to relaxation. Nitroglycerin works as a vasodilator by releasing nitric oxide. This increases the levels of cyclic GMP in blood vessels. Therefore, using nitroglycerin with PD5 inhibitors results in additive effect, leading to a significant hypotension. That's why you should never combine nitroglycerin with PD5 inhibitors. A small amount of these medications may remain in your body for a few days after use. Therefore, a recent use of PD5 inhibitors may also affect hypotension produced by nitroglycerin. That's why before starting nitroglycerin, check the usage of PD5 inhibitors for the past few days. When to avoid? Or do we have seen that nitroglycerin should be avoided with PD5 inhibitors? What are the other conditions that still affect? Nitroglycerin may reduce hemoglobin levels. Therefore, use of nitroglycerin is not recommended in people with severe anemia. Being a vasodilator, nitroglycerin can cause dilation of cranial blood vessels. This causes a stretch that stimulates sensory receptors to perceive pain. Pushing of these blood vessels towards the rigid skull structure may also result in an increase in intracranial pressure. Therefore, in people with raised intracranial pressure, as observed after recent head injury and trauma, use of nitroglycerin is not recommended. Avoid using nitroglycerin if you observe any hypersensitivity. Effect on blood pressure. Nitroglycerin acts as a vasodilator and improves the symptoms of angina. However, it can reduce systolic blood pressure. This may be well tolerated under normal conditions when it is used alone and not combined with other vasodilators. However, when it is combined with other medications that lower blood pressure, may have significant hypotensive effect. Lowering your blood pressure may result in an increase in your heart rate. Occasionally, it can also produce paradoxical bradycardia. Significant consumption of alcohol may also add to hypotensive effects. The hypotensive effect produced by nitroglycerin is influenced by many factors. In people with blood volume depletion, existing hypotension, cardiomyopathies, congestive heart failure, acute myocardial infarction, or poor cardiac function, use of nitroglycerin may increase the risk. Now let us see the side effects of nitroglycerin. The most important side effect of nitroglycerin is the headache. It is dose related and sometimes it may be severe. Therefore, with each application of the dose, headache may be increased. However, you can observe headaches in early days of therapy. On continuous use, tolerance may be developed, leading to reduced severity of headache. Headache can be controlled by use of analgesics like aspirin or acetaminophen. Induction of headache is also reversible and it may disappear slowly by stopping the use of nitroglycerin. However, without using an alternative agent, never stop this medication suddenly. The adverse effects of nitroglycerin ointment are more pronounced in the elderly. Nitroglycerin can also produce dizziness and lightheadedness in the people. It can also cause hypotension and tachycardia. In a few people, it can produce allergic reactions. Methemoglobinemia is another important side effect of nitroglycerin. Blurred vision is another important side effect. If blurred vision persists for longer periods, then discontinue the use of nitroglycerin. Flushing, nausea, nervousness, and dry mouth are other important side effects. So that's all about this medication, nitroglycerin ointment. Headache is the important side effect of nitroglycerin, which can be observed more in the initial days. So with proper precautions and doses, nitroglycerin ointment can be used to prevent angina attacks. So that's for today. I hope this video is useful to you. If you really like this video, please subscribe to our channel. Share this video with your friends and relatives. Post your comments in the comment section below. Thanks for watching. See you in the next video.